There are so many decisions to make with regards to Medicare. Even if you've decided that you want to go the Medicare supplement plan route, there are still 10 plans to choose from. One of the plans that's been growing in popularity is Medicare Supplement Plan N, and that's what we're going to talk about in today's video. Now, as always, if you have any questions whatsoever about your Medicare coverage, you can of course give us a call at the number on the screen, and you can always send us a message in the comments below, and we are happy to answer your questions. Now, before we dive too far into today's video, please make sure to subscribe so that way you stay up to date, because we do release these videos on a weekly basis. And of course, make sure to give us a like, click that thumbs up so we can get this information out there. Okay, so today, as I said, we are going to be talking specifically about Medicare Supplement Plan N. Now, all Medicare supplement plans work in conjunction with Original Medicare, and that's Part A and Part B. Basically, they're going to fill in those financial gaps of Original Medicare, namely the deductibles and copays and coinsurance. But what they're not going to do is offer additional benefits that aren't already offered by Original Medicare. This is where a lot of people get confused. So you're not going to be purchasing dental, vision, hearing, or prescription drug coverage by purchasing a Medicare supplement plan. So your Medicare supplement plan, also known as a Medigap plan, will work with Original Medicare. Now, Part A is your hospital insurance, and Part B is your outpatient insurance. And honestly, together, they're going to cover most of your healthcare needs. However, those deductibles and copays and coinsurance can definitely be a financial squeeze for many people. And that's where these Medigap plans come into play. So let's just take a quick look at what those deductibles and copays and coinsurance might be without a Medicare supplement plan.
So this is Medicare.gov. On this page, you'll get a better idea of what the costs associated with Original Medicare are. So let's start with Part A. We're just going to scroll down. So first is the deductible. So this is not a once annual deductible like you've probably experienced in the past. It is actually applied per benefit period. That term can be a little bit complicated, and we do go into further details in another video, which I will link in the description below. But basically, you can think of a benefit period like a hospital stay. So if you were to have multiple hospitalizations in a given year, then you might have to meet that deductible multiple times for each benefit period or hospital stay. Now, in 2023, the deductible for Part A is $1,600. So you would have to meet that out of pocket if you were hospitalized, unless your supplement plan covered the Part A deductible. Then if you were to scroll down, you're going to see there's different types of care covered by Part A, and the coinsurance is determined by the type of care facility and the length of stay. So for an inpatient stay in the hospital after you've met your deductible, there actually is no coinsurance for days 1 through 60. If you needed to be hospitalized for longer than that, then there is a significant coinsurance. For example, in 2023, for days 61 through 90, it is $400 per day. Then if you had to stay longer than that for days 91 through 150, it would be $800 per day. Now, it's highly unlikely that you would be hospitalized for this long. It's more likely that you would then be transferred to a skilled nursing care facility. So once you're there for days 1 through 20, it's a $0 copay. But if you were to stay for longer than 3 weeks, then it is $200 per day. And that is certainly very significant. Now let's scroll down to Part B. Part B is a little bit easier to understand. So there is a deductible. It is a once annual deductible. So once you've met that for the year, you don't have to meet it again. In 2023, it's $226. That's actually down from 2022, which is unusual. And then once you've met that deductible, you're responsible for 20% of the cost for the Medicare covered service. And that's basically it. So it's much easier to understand. Now let's look at Plan N. So if you see here, this is actually going to compare all of the different Medigap plans available, but let's talk specifically about Plan N, which is over here on the right-hand side of the screen. So as you can see, it will cover your Part A coinsurance and hospital costs. It will also cover your Part B coinsurance and copays. This asterisk has to do with Part B excess charges, which we will get to later in the video. It will also cover blood, first 3 pints if you need a transfusion, Part A hospice care coinsurance or copays, skilled nursing facility care coinsurance, and that's very, very important because as we discussed, that can really be quite expensive if you need to stay for more than 3 weeks. Your Part A deductible, which remember that's applied per benefit period, It doesn't cover the Part B deductible, but that's really rather a negligible amount. And the only plans that do cover that would be Plan F or C, but those are no longer offered to new enrollees. And it doesn't cover those Part B excess charges. Again, we will get back to that in just a minute. And then if you were to travel for a travel exchange, 80%. And there is no out-of-pocket limit here because it really is going to cover all of your additional costs except for those potential Part B excess charges. So there is no out-of-pocket maximum because you really don't need one.
But what does it cost? Like all Medicare supplement plans, your monthly premium is determined by a series of factors, namely your age, your location, the carrier that you choose, and whether or not you're going to be subject to medical underwriting. So you can enroll in a Medicare supplement plan year-round. There's no specific enrollment period, unlike Medicare Advantage or Medicare Part D. However, it is in your best interest to enroll in a Medicare supplement plan when you are first eligible. This would be the 6-month window after you turn 65 and enroll in Medicare Part B. During this time, you will not be subject to medical underwriting, which means you'll basically have your pick of the Medicare supplement plans. Should you choose to enroll after this time period, then you may be subject to medical underwriting, which means you could be denied or charged more. That being said, let's take a look at the prices just to give you a jumping off point.
So on Medicare.gov, it's going to ask you to put in your zip code and select a plan type. We're just looking at Medigap plans. Remember, your premium is largely determined by your zip code, the area in which you live, so prices may vary dependent upon your geographical location. Now, if you wanted to get a more accurate price, you would put in this information, but let's just take a look without that. So scroll down to where you would find Plan N. And it is a pretty large price range, somewhere between $158 to $1,525. So let's go back up and actually put in some information. Let's scroll back down. And that has narrowed the field quite a bit. Now it's looking somewhere between 158 and 312. Again, it is highly dependent upon your age, where you live, and if you require medical underwriting. So your prices may vary. Now, if you were interested in this plan, what it's basically going to tell you to do is call the carriers individually. So that can be sort of a headache. You are, of course, more than welcome to call the carriers individually and explore the different prices, but you can also work with a broker who can basically give you a snapshot of all the different companies and point you in the right direction as far as the carrier that's going to offer you the lowest price, as well as a history of more stable price increases.
Now, Plan N is most similar to Plan G. The only real difference are the Part B excess charges. So basically, if a doctor accepts original Medicare, then they're willing to accept the amount that Medicare is going to pay. However, they can charge up to 15% more, and this is known as a Part B excess charge. Now, if your supplement plan does not cover Part B excess charges, then you'd be responsible for that additional charge. And really, the only plan available now that does cover Part B excess charges is Plan G. Now, in the interest of full transparency, in all honesty, Part B excess charges are not that common. And they're not even actually allowed in all states. So that is something to take into consideration. But we do recommend that you work with a broker. That way you can determine exactly what level of coverage is most appropriate for your needs. If you are somebody who definitely wants to take those Part B excess charges off the table and have a complete idea of what your yearly healthcare spending would be, then you might want to go for Plan G instead. Now, if you have decided that Plan N is right for you, or really any Medicare supplement plan, remember that benefits are standardized. So Plan N is going to be the same regardless of the carrier that you choose. And if your doctor accepts original Medicare, they accept your supplement plan. It doesn't matter who the carrier is. So make sure that you're picking a carrier with a history of low and stable rate increases. Because of course those rates do tend to increase on a yearly basis, you just want to make sure that your rate doesn't jump drastically from year to year. So again, that's why you might want to work with a broker. Now, if you have any questions whatsoever, please feel free to give us a call at the number on the screen, and you can always send us a message in the comments. In the meantime, do make sure to subscribe because we release these videos on a weekly basis. And as I said earlier, make sure to click that like button, give us a thumbs up so we can get this information out there. As always, thank you so much for watching and have a wonderful day. Bye-bye.